I will be sharing the information I gathered when researching cerebral palsy. The Mayo Clinic defines cerebral palsy as a disorder of movement, muscle tone, or posture that is caused by damage that occurs to the immature developing brain. To put that into simpler terms, cerebral palsy is caused when a brain injury occurs. This may happen before, during, or immediately following birth. The most common symptoms are variations in muscle tones, lack of muscle coordination, tremors and involuntary movements, delays in motor skills milestones, excessive drooling, difficulty eating, delays in speech development, and finally seizures. Symptoms range from mild to severe depending on the severity of the CP. The diagnosis normally happens within the first 2 years of the child's life. The doctor may suspect they have cerebral palsy and will first evaluate the child based on signs and symptoms that they had, review past medical history, and conduct a physical assessment. For further diagnosis, the doctor may ask to perform a series of scans, including an MRI and a cranial ultrasound, to reveal if there's any damage to the brain. Laboratory tests are conducted to screen for genetic or metabolic problems. Additional tests the doctor may ask to run are vision and hearing impairments, speech delays, intellectual disabilities, and movement disorders. After the diagnosis, next is finding out the cause. There are many reasons why a child has developed cerebral palsy. The most common one is mutation to the genes, infections to the mother during pregnancy, fetal stroke, traumatic head injury to the baby, and finally lack of oxygen. While these are the most common, it is different for every child. It could be one of these reasons or a combination. Next, treatment. The child will be recommended to a team of specialists to help with long-term medical care. This team includes a pediatrician, pediatric neurologist, orthopedic surgeon, physical therapist, occupational therapist, speech/language pathologist, developmental therapist, and many more. This team works together to develop a plan of treatment individualized for the child. There are 3 tiers of treatment. The first is medication. The child's doctor can prescribe medicine to lessen the tightness of muscles and improve functional abilities. Next tier is therapies, physical and occupational. In physical therapy, a child with cerebral palsy will do different training to gain muscle strength, flexibility, balance, motor development, and mobility. In occupational therapy, the child will be encouraged to become more independent in daily activities. And finally, speech and language therapy helps improve ability to speak clearly and communicate. As more research is being done on children with cerebral palsy, more equipment is being released. This helps to accommodate the child and make life easier for them. The first equipment is the nosy cup, which is designed to aid children when drinking water by themselves. The design is to eliminate the frequency of spills. Next, the soft shell helmet. Due to problems with balance and coordination, the soft shell helmet is designed to protect the head in case of a fall. Most children affected with CP live between 30 and 70 years, depending on the severity of the condition. Currently, there is no cure. However, there are ways to improve the child's life expectancy, which are starting care and treatment early and improving the child's motor skills and independence as much as possible. This gives them the best chance to live longer. Cerebral palsy is the most common motor disability in children. About 3 out of every 1,000 kids have cerebral palsy. In the last 40 years, the number of people with cerebral palsy who are active in the workforce has almost doubled. As medical research and awareness improves, so will the outlook of children with cerebral palsy.